we now have a medical staff which is more robust, and the fact we got redundancy in call schedules. Where back in the day we had 3 guys covering a service, we might have 5 or 6 now. So we got significantly more redundancy and capacity than we did before, and in all areas of the medical staff. The community really does have to be involved in healthcare, whether that's through the philanthropic, through the foundation, through lobbying, MLAs, etc. We certainly need to be involved, all of us, to make sure that we have the right source, the right tools for the right people, whether that be long-term care beds, home care services, equipment in the operating room, those kinds of things. If somebody gets sick with COVID to be hospitalized in North Island, they will come here. If they are sick enough that they will need exceptional care in that prolonged ICU stay, etc., which we aren't really tooled to do, they will be transferred to Nanaimo. So what does it mean to the site? It means that it puts sort of pressure on us to have the ability to gear up and have, I'm not sure what a volume that we're actually looking for, but my sense is we feel that we should be able to handle about 20 people. Some of them real sick that need to be temporized, meaning keep them going until they can end up in Nanaimo or Victoria. And then look after those other people until they convalesce and are able to be discharged back to the community, which requires us to identify areas in the hospital and procedures that are going to allow us to deal with that many people. My sense is a lot of people, when they kind of went into the bottom rungs of starting their healthcare careers, from whichever way they came, nurses or paramedics or physicians or lab techs, they had a bit of an altruistic part of their reasoning. Might have been, it looks a good career, but at the same time there was some altruism there. And when you get into the daily grind, sometimes it wears you down, and you might lose a little bit of that optimism and that whole caring spirit. The fact that this catastrophe was coming upon us, it brought that out of everybody, and it's still up there. We had kind of, you go about your daily business, you get up, have your cup of coffee, and come to work. But there's been a bit of a different calling when the COVID thing came, because they were asking people for opinions, and you were getting the ability to create something. How are we going to get people in and out of the X-ray department safely? And everybody was involved, and they stood up and they got counted. There was people coming out of the woodwork wanting to participate, and I think a lot of those people got kind of renewed by this whole exercise. What was most remarkable was over that a period in mid-March was just the cohesion of the staff, all the staff. Nurse leaders would come and say, Phil, we need to do this, and we got this, we're working on this plan. And then, it was a Tuesday night in the middle of March, all the medical staff, I don't know how many people were in the room and how many people were on the phone. I think it was 100 and some. Okay, what are we going to do? Well, we got sort of 6 primary drivers here, and we made a plan and presented the plan to management. Management presented it to Island Health. Island Health came up and did the walkabout. It became a team. The first couple of weeks, the amount of baked goods and pizzas, and, just the community pulling together, but that was also reciprocal the other way. Everybody had that kind of spirit that, boy, this is something we got to come together. The community has done a fabulous job of following the medical health officer's guidelines. Stay apart, stay distance if you can't. Plexiglass, masks. Stay home when you're sick. Minimize your trips, etc. So that's what we've certainly felt that impact. That the island and in general has done a fabulous job of keeping the animal in the box. Keep my fingers crossed, because things are certainly changing rapidly. But that's sort of our number one impact. And number two is realizing that we're supported. That whole, not just pizzas and donuts. It was, people coming with boxes of N95 masks from car dealerships where the paint guys in the body shop would be using them, and they knew we were short, so they would bring them. Those kinds of things are quite fabulous. all through spring of 2019, there was a big push to get hip and knee surgeries done. We were behind in some cancer surgeries, we were behind in pediatric dental surgeries. There was a whole list of to-dos. Then COVID, sort of the ramp up for COVID, which meant we were projecting how many beds were going to be needed off service, et cetera. So the surgery, we can't be doing surgeries because we don't know which day that the dam will break. So not much happened for a couple of months in terms of getting surgery done. And so we got a huge backlog. Well, catch up, what does that require? Well, in this building, we have 6 operating rooms. Well, 4 of them were funded. Well, now we've got some funding for the 5th, and it's a question of getting the people to run that. We've got surgeons, we're working on anesthetists. It's a question of the ancillary staff, that being nursing and technology and occupational therapy and physiotherapy and all those sorts of pieces that's required. That's a big demand on, and then keeping the beds open for people to go to convalesce after their surgeries. And if you can get up and get moving, well, if you can get up and get moving, maybe you can be home. What services are needed? There's a huge big piece of the puzzle is getting enough services outside this building to allow people to get home and be in their own bed to rest, because we know they move around more if they're in their own facility, and that's oftentimes the key to recovery, is get up and get going. The most exciting thing is the staff, and just looking at all the new young people that have come here. The questions that we get asked in an interview, well, how about daycare? So we got lots of young people that are going to have 30 and 40-year careers in this building, and we've hired quite a few of them in the last little while. And so that's the exciting thing. We got a young, dynamic staff that are passionate, and they're current, and they want to do things better, and that's what the future holds. Lots of people with great ideas and the energy to implement them.